Hello.
I have 5 now. You can start.
Hello, everyone.
Hello, ma'am.
I'm Dr. Kamal Heather, your mentor for MRCOG Part 3. Firstly, I would like to express my gratitude to Instutors for providing a platform to help those who are struggling with MRCOG. Secondly, I would like to extend my congratulations to everyone who has passed MRCOG Part 2. I believe that you will soon become a member of Royal College. I understand that everyone who passed the MRCOG Part 2 has comprehensive knowledge, and the majority of you are working in this field in good positions. It's great that you have access to guidance and direction from institutors to help you manage your studies with your busy schedule. If you are looking for more information after passing your MRCOG Part 3 on how to register the General Medical Council and find a job in UK, Ireland, Australia, and even the Gulf countries to fulfill your dreams, Med Institutors is here to provide you guidance and support. Let me move on to today's webinar. During this session, I will discuss with you some problem with the presentation. 1 second. Yeah. So today's webinar, we will discuss first of all exam structure, then what will be upcoming exam dates and where the exam venue this year, how much is the exam fee, what is the booking process, and I will guide you about the study material and practice session as well if anyone want to volunteer with me. So first we will discuss about the exam structure. So everyone know that MRCOG Part 3 is a clinical assessment exam that consists of 14 tasks in a circuit, and each task based on one of the 14 modules. These are our modules: teaching, core surgical skills, post-operative care, antenatal care, maternal medicine, management of labor and delivery, postpartum problems, gynecological problem, subfertility, sexual and reproductive health, early pregnancy problems, gynecological problems. We need to cover the oncology as well. And one station from the urogynecology and pelvic floor of problems also, like the stress urinary incontinence, overactive bladder, prolapse, these kind of the cases. Now, coming to the assessment of the patient. So in each module, the student will be assessed on the 5 domains. These domains are the patient safety, which is a most important domain. You need to pass the patient safety in every case scenario. If you are unable to pass the patient safety, that means you are unable to pass the exam. And I will tell you very small tricks to pass the patient safety in our upcoming sessions and in our long course as well. And the second and third, the communication with the patient, how you're communicating with the patient, and communication with the relatives, like before taking any patient to the OR, if the patient has postpartum hemorrhage, so how you can counsel the family, the husband. And one is an important domain is our information gathering. That means simply the history taking. Everyone know the how we are taking the history. But in MRCOG Part 3, they are not expecting from your side to take a detailed history. They want only a concise history, and usually the history taking time is 3 minutes. It's very difficult to listen that how we can take a history in 3 minutes, but I will guide you. I will provide you all the templates related to every case, that how you can take a targeted and concise history in 3 minutes. Now, the last domain is a applied clinical knowledge. This applied clinical knowledge is consist of TOG articles, NICE guidelines, RCOG green top guidelines, and the very important thing is a patient information leaflet. You need to read patient information leaflet with every scenario. I will provide you all the compilation of our patient information leaflets. So that regarding the timing, each task is consist of 12 minutes long, in which you have an initial 2 minutes for the reading time. And after that, 10 minutes is your performance. So at the end of our webinar, when we will do the practice station, so you know it very well. Any questions so far? Okay, so we can continue. So regarding the type of task, we have a two type of a task in our part 3 scenario. One type is a simulated patient or colleague task. In this task, the candidate interacting with an actor who has been fully trained and fully briefed in their role, and he or she is to play. The actor will know all the relevant details to the case, and they have a script as well. So if they are prompting you in between the session, so that means you are missing something. So you need to listen carefully. The second type of a task is very straightforward, is a structured discussion task. These are like the candidates interacting directly with the clinical examiner, like usually the consultant level senior. And the examiner also have a detailed instructions about the task. And they have a list of questions that they can use you prompt to the candidate or move to the task further. The examiner may give the candidate further information as the scenario evolves and ask the further questions. The examples of a structured discussion like the labor ward prioritization, a pre-op gynae list, post-op gynae list, or they are more concentrating for any new TOG article and any new guideline. Okay, so regarding the next slide. Yeah, this year the exam calendar, we have 2 dates announced already by Royal College. First is in May 2024 and the second one is November 2024. Regarding the centers for the exam, so this year exam will be conducted in London, Singapore, Malaysia, UAE, and 2 centers in India, in Delhi and Chennai. So the most important thing is the exam fee. So you already passed the MRCOG part 1 and part 2. So you have idea about the banding system of our Royal College. They divided all the countries in the band A, B, and C. And the UK and Ireland, the fixed fee is £574. If you belong to the Band A, your fee is £919. If you belong to the Band B, so your fees will be £857, and in the Band C, 629. You can see your countries. I will provide you the list, and also you can visit the RCOG website to see where you are falling in the banding system. So if you can see briefly, these are the some Band A countries like France, Georgia, Japan, America, UAE, Saudi Arabia is also coming in the Band A. For the Band B, we have Bangladesh, Egypt, India, Iran, Pakistan, Philippines, Sri Lanka. Now in the Band C, the Afghanistan, Ethiopia, and Palestine, these countries are in the Band C. Now coming to the eligibility criteria to sit in the MRCOG Part 3 exam. So first of all, you must have completed and passed MRCOG Part 2, and also you had your assessment of training approved. That now is a requirement to sit into the Part 2, that you need a 4-year experience in obstetrics and gynecology. I hope, am I clear? If you have any question, please write in chat box. I will be happy to answer all your queries at the end of my webinar. So the booking process, the priority window will open on 29 February 2024, and window will close on 4th March. The second window open on 7th March and window close on the 11th March. RCOG will send you the link how you can book. I will guide you regarding that, because booking of the exam is also very challenging. But if med institutors are here, they will help you in every step of your journey. And when you will get a result of your My attempt, usually the result is coming after 40 days. So the RCOG announced the date for the My attempt is in 12th June 24. Now coming to the study material, from where you can study. So the study material is in the NICE guidelines. If you will join our long course, so we will provide you the concise summary of all the NICE guidelines and also the green top guidelines. Also, we will provide the summary of all green top guidelines. And RCOG scientific impact papers are also very important. You need to read that one. The consent advice for dilatation and curettage, the consent advice for cesarean section, the consent advice for hysteroscopy. So we will provide you all the materials in our long course. And also you need to read the TOG articles, at least recent 3 to 4 years. We will provide you the summary of the all recent and important TOG articles. One very important thing is to read the patient information leaflet. Usually in the case-based scenario, the role players asking about the same questions written in the patient information leaflet. So very good strategy. If you are reading any topic, you can read the patient information leaflet along with the station, so you know how to give the answer of the role player. And also in the different scenario, they want you some numbers and some percentages. Like the role player is asking, how much is a chance for abortion? So it's clearly mentioned is in the patient information leaflet. So patient information leaflets are very important. Now, coming to the books, books are not recommended, but for our practice, we need to practice these 5 books. These all are the standard books, and very good scenarios are there in the books. We need to do the Tony Hillington, that's OSCE. Previously, the OSCE is considered as a part 2, but now it's a part 3. But we can do this book. Get Through MRCOG. It's also a very nice book. And we need to do the Justin Conji. And our Bible is like that, Lisa Joel. You need to do the scenarios given in the Lisa Joel in very detail. And the 5th or the last book is Oxford. So along with the Med Institutor, every week I will do the scenarios from these books. But I need volunteers to participate with me to do these scenarios. So I will help you. I will guide you that how we can ace our MRCOG Part 3 in our first attempt. Really, it's a tough journey, but you need a guidance and proper direction that how you can prepare your exam. So, do we have any question? I'm happy to answer. Please, if anyone have any question, please write here. Okay, the one question from the Amna is process for booking a slot for the MRCOG Part 3. Amna, the exam slot will open in the February. After submission of the fee, the RCOG will send you the link and with the time. So you need to log in with that specific link that is only for you. And then you can book your exam and then you can pay your fees at that time. Any other question? We already discussed the exam dates, Nusrat. Would you like me to go to that slide again? No problem. We can see again the exam dates. Regarding the exam date is in the February and is in the November. Now I'm going back for the exam dates. Okay. Are you able to see my slide? So the exam date for MRCOG Part 3 is 2024 is a 8 or 9 May and 13 and 14 May. And in the November, 6 to 7 May and 11 to 12 May. So RCOG will announce later on which center has date, which center has a date on which day. Now, other question that someone is asking, what is the current fee structure for MRCOG and there is any additional cost should be aware of? Very nice question, Masuma. Masuma, the exam fee structure is depend upon the banding system. For example, if you are from the Saudi Arabia, you are from the UAE, your fee is little bit on a higher side. It's called a band A. And in the band B, your fee is little bit less. And the band C, I explained to you, like Afghanistan and Palestine, these countries are considered as a band C. Regarding if you want to book your exam for London, you want to go to London. So in this condition, the additional charges for the visa, for transportation, and for the hotel. If in your country you don't have a exam center, like if you are belonging to Pakistan, so in Pakistan the RCOG is not conducting the exam, so you need to book the exam either is in the UAE, or you need to go to the London. So this is an additional fee. Regarding the fee in Bangladesh, uh, I will again go to that slide. I think Bangladesh is also in the band B. Mhm. So if you can see, the Bangladesh is included in the band B. So if we can see, the band B fees is £857. It's the booking. If you are booking from the Bangladesh, but you can choose a center anywhere. Either you will go to the London, or you can go to the UAE, or you need to go to the India to give to exam center. What advice do you have to candidate regarding effective preparation strategy for MRCOG Part 3? Very nice question, Aisha. Aisha, from my side, I need to advise that believe on yourself, study hard. You need to revise all the stations. I will tell you, we have only the 200 to 250 stations. If you can do that, I will guarantee you will pass in first attempt. And if you will connect it with the Med Institutor, so we will provide you the sessions regarding the station depend upon the modules. Hope I'm clear, Aisha. Roa, thank you for your question. Regarding the preparation, it depends upon how much knowledge you have at your background, and also how much time you are able to give to your study. If you are working every day 8 hours, so you can spend the time 3 to 4 days, 3 to 4 hours every day to prepare for the exam. But if you are working the 12 hours, or you have a family responsibility, so you need more time. The question from the Mamuna, ma'am, are there restrictions on the use of an electronic device? Yes, in the exam center, you are unable to take electronic device, even you are unable to carry your watch. How you can know about the 10 minutes time? The examiner is prompt you, or if you are practicing the station, so you have idea, then now it's going to finish the 10 minutes, so you need to wind up your station. Memuna, your question the same, that regarding the electronic devices? Is still not yet clear? You are unable to use any electronic device. They will provide you one pencil, or one that writing pad you can write there. Which question, Memuna, you're asking again? One second, I will go up. Restriction, how many months needed? Aisha, Memuna. Electronic device, Memuna, your question? Number of attempts you are allowed to give the MRCOG Part 3 exam. You need to pass in the 3 attempts. If you are unable to pass into the 3 attempts, you need to give the Part 2 again. This is an answer for Jamila question. Any other question? Okay, now This is only just the basic of our MRCOG Part 3. If you have any more question, please write it again, or I'm scrolling up. Okay, so from you guys, my audience that I have, how many candidates now? How many participants we have? We have 32 participants. If anyone want to play a role of a role player, so I will give one station to practice. After practicing this station, you know very well that how I will teach you in the future or how you need to prepare the exam. So anyone is ready to volunteer with me? One more question from the Bhavna. Bhavna is asking about what about the training? As you told, after MRCOG Part 2, how much training is needed? Is there time limit? No, they don't asking the training after the MRCOG. They want only a total training in a obs and gynecology for 4 years. This is either even before your MRCOG Part 1. If you can apply, then RCOG can accept it easily. It's not that tough. And when the exam results communicated, when are the exam results? So I told you the exam date is in the June. So in the June, the RCOG will send you the mail regarding your exam result. Bhavna, your question that regarding the training, if you did the training even before the MRCOG Part 1 or during your MRCOG Part 1 and Part 2 or between Part 2 and Part 3, you can apply for RCOG and RCOG can accept that training. There is no limit for the duration that in this duration they want they want only a 4 years training. Any other question? Anyone want to volunteer with me right now? Or I can pick from the audience from myself. What about the back team is asking? What is your question, Duryadam? I mean, if training has been done few years back. Yes, if you did the training even the few years back, it is accepted because they want only a 4 years of obs and gynae training anywhere in your life you did. But before sitting into the MRCOG Part 3, you need to assess the training, your training. So anytime you can do that training and you can send for RCOG, that the documented proof. Duryadam, I think I already explained your query. Yeah, so anyone want to volunteer with me? Mm-hmm. We
Yes,
have
ma'am.
any volunteer? Hello?
Yes, ma'am. We have Dr. Roa with us.
Hi, Dr. Roa. How are you? Dr. Roa, am I audible?
Hello,
Please.
hello, yeah.
Hi, Dr. Roa. How are
Hello,
you?
hi, fine, how are you?
I'm good. Dr. Roa, can you give some brief description about yourself to our audience? We have a very good number of audience. We have 32 participants here. So they want to know about the Dr. Dua.
Okay, I'm Dr. Rafik Ali Ahmed. I'm Sudanese doctor. I'm a specialist in obstetric gynecology since 3 years back. I'm working in Gulf country.
Okay.
Me,
So
I'm
Dr.
preparing for MRCOG 3 at September.
Oh, very good. Very good. Good luck from our side, Roa. So Roa, where are you working these days?
In Oman.
Oh, that's very good. So, Roa, are you going to attempt MRCOG Part 3 first time?
Yeah, first time.
Okay, good luck. If you will go first time with the good preparation, so inshallah you will pass. So you are ready to become a volunteer with me?
Inshallah.
Okay. So Roa, now you are able to see the screen, your task.
Yeah,
Okay.
yeah.
So you can, I have 3 slides. You can take your 2 minutes for the reading time. When you will finish the reading of this slide, then tell me, then I will change the slide. After taking your 2 minutes, you will be you will be the candidates and you will take a history and you know how we can proceed the station. Do you have any question, Roa?
Okay, first I will read the slide.
This I have 3 slides, so now I'm starting your time. Now the time is from my side is 33. You can read. You have 2 minutes. When you finish this slide, then tell me. Then I will change the slide for you.
Okay. Okay, next. We can do development 8 year old prevention of children and non living encouraged by pregnancy. Okay. Yeah, if the five and the businesses is maybe honest with the story to the success and brand and with combination of the famous people like the people having the way with making for service for the year we have 10 minutes paper history and their movies and management plan. Okay.
You have
Previous slide. Previous. Just
you
a minute.
have 1 minute
Slide.
more. Sorry, Roa.
Previous slide.
Okay.
Okay. Okay. You can move on. Okay. No. Yeah. Okay. Thanks.
Take 1 more minute to organize your thoughts.
Okay.
So, are you ready?
Inshallah.
Okay. So now we have a 10 minutes. Okay. Now you can start.
Okay. And first of all, I will start by taking history. She's 26 years old. I will
Roa, you
ask
need
for
to take a history from me. I'm your patient.
you are my patient. Okay.
Yeah.
Hi, Elia. Hi, Eli. Hi, Mrs. Eli. I'm Dr.
Hi.
Roa. I'm Dr. Roa Fakir. I will ask you question. Can I ask?
Yes.
I heard you are 26 years old and
Yes.
you have unwelcome pregnancy. This is the first this is the first time you get pregnant.
Yes.
Any previous cervical history?
No.
Any previous pelvic inflammatory disease or any
No.
vaginal discharge?
No.
Any contraception history like IUCD or other?
Yeah, doctor, we were using condoms because we are not planning pregnancy right now.
No. Okay.
So, doctor, this is an unplanned pregnancy. So I want to terminate this pregnancy.
Okay. Already you have a mild abdominal discomfort and it is most likely, it is most likely it is ectopic pregnancy.
What is ectopic
And
pregnancy, doctor?
it is ectopic pregnancy, that is a pregnancy. It is not normal pregnancy, not intra-uterine pregnancy. It is extra-uterine pregnancy. And it is the size already, it is 2 by 2 cm, and you have minimal beautiful fluid collection.
Okay.
And
So
you
what can I
already have many ways for many this ectopic pregnancy. It is either medical treatment or surgical treatment. But already you have a mild abdominal discomfort and minimal pelvic fluid collection, so we cannot go towards the medical management. We'll go directly for surgical management. For you, as you have no previous surgical, we can go for laparoscopic surgery. Like we will do for you salpingectomy to remove the ectopic salpingectomy to remove the ectopic pregnancy.
So doctor, you want to do surgery right now?
Yeah.
You will do my surgery?
After you consented, after you get my consent and discuss with your husband.
Okay, so you are able to do laparoscopy, doctor?
Yeah, for sure.
Okay, so I'm ready.
Okay. We will do for you salpingectomy, remove the tube to remove the ectopic pregnancy. And intraoperatively, we'll see the other tube. If it is good and healthy, we'll take the tube that affected. If not, we will just take the ectopic pregnancy to preserve your fertility.
Okay.
Any issue? You want to ask me any question?
So doctor, do I need a blood transfusion as well?
It is uncommon that in this laparoscopic operation to massive hemorrhage or intra-abdominal bleeding, but we will prepare it.
Okay. But doctor, I'm Jehovah's Witness. I am unable to take a blood.
Okay, so we will not transfuse for you. If there is any intraoperative bleeding, we will manage.
Okay, doctor. So doctor, if you will do the surgery right now, so how much is the chance that I will get it again, another ectopic? How much is the percentage?
Another ectopic, we have like 20%.
Okay. Okay, doctor.
20%.
Mm-hmm.
20% the risk that you have may carry the risk of ectopic again.
Okay. Doctor, I don't want surgery if I will go home. So what happened?
If you will go home, may happen many complications that this ectopic pregnancy maybe will give rupture. Rupture will lead to be you in shock or in collapse suddenly.
Okay. So you don't want me to go home?
No.
Okay, doctor, I'm ready for surgery now.
Okay, just give me the consent and sign, and we will prepare.
Okay, doctor. Thank you.
Thank you.
Yeah, very good, Dr. Roa. But how do you feel about your station?
It is good. Just need me more concentration and the diagnosis should be right since first time. If I wrong in diagnosis, all station will be wrong.
Mm-hmm. So very confidently you diagnose a patient ectopic pregnancy on only the basis of one beta CG result. You can able to diagnose ectopic. You have only one beta CG reading. You don't know after 48 hours. First of all, Dr. Roa, thank you so much that you volunteer here for the participation. But you did very nice. You finished before the time. But obviously, I want to make you perfect in this station. So that's why I want to give some suggestion. Is that okay for you? Hello, Roa.
Yeah, for sure.
Yeah. So, Roa, if we can see our station, why they wrote like that patient is waiting for 30 minutes for review? Any specific reason or just they wrote the sentence?
She's waiting for 30 minutes for review.
It's written here. She's waiting for 30 minutes for the review.
Mm,
She's in pain.
I don't know.
No problem. I will tell you. Because in this kind of a scenario, first you need to apologize from the patient that sorry for the delay. You are here
Mm,
because of the unavoidable circumstances. You need to wait. And we are looking into the matter, and it does not happen with the other patient. Can I continue the consultation? Then you can ask the patient the permission. Got my point?
mm. Yeah, I got my point.
Because
Yeah.
everything written in the scenario has some meaning. Here is written another, in the same slide is written unwelcomed pregnancy, that she don't want pregnancy, she told you. So when you are going to end up your session, you need to counsel the patient of upcoming contraception, because this is an unplanned pregnancy. So obviously in the future she don't want any unplanned pregnancy. So at the end we need to counsel the patient about the contraception.
Mm,
So, Dua, if I will do instead of you, so how can I do? Okay, just now you are my patient. I'm your I'm a doctor. You are a patient. We can do like that.
yeah, yeah.
Okay. Hello, I'm Dr.
Okay.
Kamal, one of a doctor in the early pregnancy assessment unit. Is this Ely Wilson,
Yeah.
26 years?
Yes.
Because just I need to confirm because it's very important for the patient safety point of view. Okay. How would you like
Mm.
me to address you?
Easy.
Okay. Ellie, I'm sorry you had to wait because of some unavoidable circumstances. We are looking into this matter, so it does not happen with other patients. Can I continue the consultation?
Yeah, sure. You can continue.
Thank you very much, Ellie. All right, Ellie, I understand you have been having some tummy pain. Is that right?
Yeah, right.
Since when? I need to take a HOPC, history of presenting complaint. So since when you have this
Okay.
pain?
Then, since 2 days,
Okay. It's relieved by any medication?
no.
Okay. So recently you know that you are pregnant. So can you tell me about more your concern? Then she will say that this is an unplanned pregnancy. I want to terminate the pregnancy.
Mm,
Okay.
mm,
So you need
okay.
to acknowledge her concern. I understand, Ellie, and I'm here to help you. Is it okay for you? But before that, I want to ask some questions regarding your periods. When you will get your last period? When you had your last period? Because
Yeah.
we need to estimate how many months pregnancy
Mm,
she has.
Before 8 weeks.
Okay. So you told me about the any previous pregnancy. So we need to take obstetric history, any pregnancy in the past, any bleeding, any dizziness and shoulder pain. Shoulder pain is a very important sign of ectopic pregnancy.
Ectopic pregnancy.
Yeah. Then we are taking the gynae history. You asked me about the pelvic inflammatory disease. That's very good. And you need to ask about the contraception, what contraception she is taking. Medical history, simply you can ask you're following with your GP for any other medical problem. Do you have any surgery in the past? You asked me this question about the surgery. Drug history, but did you ask me about the allergy?
No.
Allergy is the passing question. If you will ask the allergy in every case, you can pass. Okay. So don't forget allergy in any case. Now, quickly, you can take a personal history regarding the smoking, alcohol, any recreational drug if the patient is young. Then you can ask about weight and height ratio. Maybe it's a very obese patient, so laparoscopy will be very difficult. So you can quickly ask, do you know about your height and weight ratio? Then you can ask that to whom she is living. You need to ask about the blood group of the patient also. If she's blood group is negative, we need to give her anti-D. Okay, this is a quick history. At the end, Rua, you can always try to ask this question: is anything add? Would you like to add? Because if you forgot something and the role player has other questions, so she will prompt you. Okay, so every history you can remind this question. Sorry. So you need to examine the patient now. You didn't examine me at all.
Yeah.
Because we are doing as our
Because
routine.
the questions, they just take a history.
But before examining how you can take the patient for laparoscopy, you are taking me for laparoscopy.
Yeah, right.
You need to take a history, then you need to examine me. You need to consent. You need a vitals, pulse, blood pressure. Then you know the severity of the disease, that if the patient is hypotensive. So regarding after the vitals, you need to do my abdominal examination. You need to see any tenderness or vaginal examination. This is history part is finished. Now come to the explanation. Immediately you diagnose me ectopic pregnancy. Is it okay? You went there ectopic pregnancy. But in the exam, talk about some manipulation. Don't give a straight answer. In this condition, maybe she has a pregnancy of unknown location. Did you read the patient information leaflet of pregnancy of unknown location?
No.
So you need to read, because in this condition, there is a chance for the pregnancy of unknown location. We don't know the location. Maybe it's an ongoing intrauterine pregnancy. The mass is visible in our site. It's here they mention the 2 into 2 centimeter. I'm unable to change the slide. Okay, so maybe it's a corpus luteal cyst. So if you can read the RUA for your homework today, you need to read the patient information leaflet today. Okay, so maybe it's an ongoing live intrauterine pregnancy. First thing. Second, your diagnosis is correct that maybe it's ectopic pregnancy. And the third thing, maybe it's already a failing intrauterine pregnancy. Pregnancy is also going towards the abortion side. Okay. So according to these three scenarios, you can take your patient. You can discuss with the ongoing intrauterine pregnancy, ectopic pregnancy, and the normal pregnancy going towards the abortion. Patient told you that I want an abortion, so we can tell the patient, okay, we are acknowledge your wishes, but first we need to know where is the location of the pregnancy. It's very important before going to the termination. Okay. You can tell like some empathetic sentences to the patient, because it's with the lay examiner. Lay examiners are not the doctor. They are just some other profession, and they can see your empathy with the patient. So you can tell to the patient, every woman has a right to take the decision that suits best for her pregnancy. It's your right. So you can just give the power to the woman. Am I clear, Roa?
Yeah, clear.
Okay. So
Okay.
after that, the patient told you that I don't want a laparoscopy, I want to go home. So you can tell to the patient the warning sign that if you have any pain, any bleeding, any shoulder tip pain, immediately come to the emergency. Okay? Because forcefully we are unable to do the laparoscopy to the patient. And
Okay.
at the end of your consultation, you can ask to the patient that, do you have any more question? Now, when you are going to finish your station, you need to tell to the patient, I will give you the copy for the patient information leaflet, because it's UK practice is very common. They have a printed one, they have an online, they have a link. So you can share the link, and you can connect with the support group. Patient need a support, she want abortion, it's unwanted pregnancy, she is in pain. Also, you can give the patient 24 hours contact number of the emergency. If she started the bleeding, severe pain, so she need to come to the emergency. And also, you can discuss a long-term contraception, that after finishing this pregnancy, you need a contraception, then prevent you to enter into another unwanted pregnancy. Yeah, Ro, do you have any more question?
No. Thank you.
So, how do you feel? How is your preparation? And because it's a very common scenario in our practice as well. But very nicely you reach the diagnosis, you counsel the patient in your language. I feel that you are empathetic with the patient. These are your positive points. Okay.
Okay, thank you.
Thank you
Thank
so
you
much,
so much.
Ruwa. Have a nice day. Good luck
Okay.
for your exam.
Bye.
Inshallah, you will pass
Inshallah.
in
Bye.
this attempt.
Inshallah.
Okay. So, any other question, anyone? Hello, any other question we have? If we have any question, so I'm ready. Otherwise, thank you all for joining today's session. I hope this session was helpful for you. If you have any further queries, you may contact Med Institutors. We will be more than happy to accompany you in your MRCOG journey. See you in our next session.
We have one more question left on the chat.
I'm searching for that. So we will repeat that's Bhavna. Bhavna, in which scan clearly written no intrauterine or extrauterine pregnancy. So we will repeat the very beta CG scan. Very right, Bhavna, because they mentioned no intrauterine, no extrauterine. That's why we have a three diagnoses in our mind. Either it's a pregnancy of unknown location, ectopic pregnancy, and it's ongoing the abortion. So we need to do the beta CG. If the beta CG after 48 hours according to the guideline, if the beta CG after 48 hours is going up double almost, that means is a normal pregnancy. Its beta CG is less after 48 hours, it means as a falling pregnancy. But if the beta CG is in between the 50% increasing but not more than 50%, that means it's ectopic pregnancy. So we need to do the beta CG, we need to repeat the beta CG after 48 hours. Any other question? Now we have some more questions. Samina said, thank you all of you for joining our session. It was a great session. Okay, so Memuna, please stay connected with the Med Institutors. I will be there, our team will be there. We have another mentor for MRCOG part 3. We will do the free sessions and we have a paid courses as well. So if you are interested, you can contact with our team and keep connected with the Facebook page of Med Institutors, so you know the update when you will have a new session. Thank you so much, all of you. Have a nice day. Good luck from my side. Bye.
Thank you so much, ma'am, for the wonderful session.
Thank you. Bye bye.